Hey guys, in this video I'm going to talk about something very important, and that is your walking ability or your recovery of walking after a stroke or a neurological injury. A lot of times patients and clients like to ask therapists when will they ever walk again, or can they even ever walk again. This is a very common question because this is a very important goal for many people, and I'm sure you may know this. So if you are able to walk, that would mean that you're actually progressing up the independence ladder, and you're actually able to do a bit more of your activities of daily livings more independently. So this is why walking is so important. So in this video, I'm going to categorize you into 4 different categories, and for each of this category, it'll be in a timestamp in the timeline below. So skip along if you do not want to watch the entire video. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. A quick disclaimer is that before engaging any of these exercises, please consult a professional such as a doctor or therapist before moving on to the exercises shown here. So the first category is for individuals with severe weakness. What I mean by severe weakness is that you have very little to minimal movements in your legs. And the aim for this category is firstly to go for your regular therapy sessions. Second, we want to get some muscle tone and muscle strength back into these limbs. And lastly, in this category, we want to prevent any muscle shortening or contracture development, because this will actually hinder your progress down the road if you do not manage it at this stage. So in this first category, what your therapist will usually be doing in therapy sessions is putting you on this thing called a standing frame, or even just getting you to stand up with a knee gaiter, or just physically supporting you into a standing position. Standing is important, and this has to be done with a therapist or a trained professional, because once you're able to stand, you're actually able to activate your trunk and also start to wake up some of your leg muscles, and eventually this strength will start to build up in a standing position. And once you're able to build up this strength, then only you can progress up to the different categories and eventually even walking by yourself. So this waking up of your muscles is very important in this stage, and if you're not having therapy sessions regularly, then this is why you need to go for therapy sessions, because you will not be able to do this at home safely. And on top of that, in this stage, you will also be exposed to different equipment such as like your neuromuscular electrical stimulation. This is just a way to electrically stimulate your muscles and your nerves so that it actually maintains some muscle strength and also maybe starts to wake up your muscles a little bit. These are all very good to be done in the early stages of your recovery, and this is why recovery and therapy is very important in this stage. In some cases, during therapy sessions, for this group of individuals, your therapist may even start to get you to walk within the parallel bar, and this means that they will be supporting you a lot. But in some cases, this will be very useful, because once you get the experience of walking, this will actually serve firstly as a motivation for you to walk more. Secondly, it will also start to wake up some of these patterns that you used to be able to do when you're walking before your injury or your stroke. So these are the main things that we done in this category. Now, moving on to home exercises. I'm going to show you some exercises here that you can do. But for all of these exercises, if you have a caregiver or if you have a family member to assist you, then they'll be very good. So for the first exercise for category 1, this is my weaker leg. Okay, you can put a towel below the heel, or actually if you're just lying down and you can actually push a bit, that's also fine. You don't need a towel or pillow underneath your heel. Okay, so what we're going to do is we're going to just push down the heel this way, and we're really going to feel the hip muscles, the buttock muscles, which is your glutes, fire up. Okay, so we're going to see it, or going to feel it fire up. Using a stronger hand, you can feel it fire up as you're pushing it down. Then relax. Okay, push down. As you're pushing down, you want to feel this glutes area fire up. Hold for maybe 1 or 2 seconds, then relax. Okay, push down, hold for 1 to 2 seconds, and relax. Push. If you can hold it for more than 1 to 2 seconds, then it's good. The longer you hold, the better it is for you. Okay, so this is a very good exercise to strengthen up, especially when you're very weak, to really strengthen up your hip muscles. Another exercise that you can do for your hip, right, is actually in this position, without anything on the heel here. I just want you to use your toes and just turn it in and out. Okay, don't let it flop. As much as you can, don't let it flop, but really control using your hip muscles here, turning your feet out and in. These are all early movements, and you don't need to do it so nicely. Even if you can just move a little bit and bring it back this way, that is already a very good start, okay? Just continue working on it and your muscle will start to come back. So category 1, which is very severe weakness, You may not be able to do all these movements nicely, but as long as you're just firing up the muscles, that is already a very good start. So go in and out 10 times, okay? In and out 10 times. For the last part, for your category 1, we are going to put a towel below your knee down here, okay? And then we're going to push your knee down onto the towel, okay? Just push and lift up your heel. So when you have a lot of weakness, very, very weak legs, you will not be able to lift up your ankle. That is fine. Okay, what I want you to do is just go through the motion of just pushing down your knee towards the ground, towards the towel. Okay, if your heel doesn't come off, that is fine. Okay, but if your heel is coming out, then that is a very, very good sign, because you are actually progressing quite a bit and you will eventually get to walking one day. Okay, just push down, hold for 1 to 2 seconds and relax. Push down your knee towards the ground, okay? Push into the towel, okay? Push down into the towel and relax. Do this for about 10 repetitions, hold for 1 to 2 seconds and do 3 sets. So for all this exercise that I just showed, do for 10 repetitions and 3 sets. Push your knee down, hold for 1 to 2 seconds and relax. And relax. If you find this content useful, do consider liking and subscribing to the channel. Additionally, I've also recently started a weekly newsletter, and this is called Rehab Recovery. Do sign up in the link provided below in the description if you want to have more content like this for more inspiration and more exercises that you can do by yourself at home. This is category 2. In category 2, you are able to sit, but you're not able to stand up by yourself. And in this stage, you will still have a lot of weakness in your legs and also in your trunk. So our aim for this category is firstly to get your trunk a bit more stronger. Second is to actually also continue the good work that you've been doing from category 1 to strengthen up your leg further, and also to get you to weight bear on this weaker leg. And lastly, also to continue going for your therapy sessions if you're in this category too. So usually in this category, what you'll be doing in your therapy sessions is similar to your first category. You'll be actually doing a lot of standing activities, either supported with a standing frame or with a knee gaiter, or just physically supporting you into a standing position. In this stage, your therapist may actually start to get you walking within parallel bars or with a lot of support with a therapy assistant. And this is going to be very beneficial for you to build up these building blocks to eventually be able to walk. So this is why therapy is also very important at this stage, and you have to go for it, especially if you're in the early stages of your recovery. In this category, you'll be able to do a little bit more exercises by yourself at home, and this will be actually a very good start for you to do this exercise I'm going to show you. So for category 2, the exercises that you can start off with, you can actually put a plastic bag for your leg. This will just help you to reduce the friction before starting the exercises. So if you're not able to put a plastic bag inside and tie it, actually you can get those Ziploc bags which is quite open. Just put your leg inside it and you don't need to close it up. You just need the bottom part of your feet to have a little bit of support with plastic so that the friction is reduced. So we're starting off with some hip rotations. So if a plastic bag like this, sit out a little bit more, okay? So this is my weaker leg. What I'm going to do is I'm just going to slide it out this way and slide it in this way, okay? So your knee is pointing forward and you're just using your hip to actually slide your leg side to side. This should be relatively easier. You don't need to go all the way out. You just go, even for a little bit of movement in this manner, is also very good already. So this is for your hip rotations. So for all these exercises, do for 10 repetitions and 3 sets. Okay, so this is your hip rotation exercise. Next exercise you're going to do is for your knee extension. Okay, this is going to strengthen up your quads, but also using a plastic bag is going to be easier for you at this stage. So you're just going to slide it forward and back. Okay. If you can lift up your leg a little bit, that's good. But if you're not able to lift your heel off the ground, that is fine also. Just sliding it forward and back is already a good start. So really focus on your quads muscles here and just slide it forward and back. So 10 repetitions, 3 sets for this leg. If you want for this exercise particularly, At the end of this movement, you can hold it there for a while and then come back in. So if you have a little bit more power in category 2 and you want to do it without the plastic bags, then this is a step up of the exercises. So for your hip rotations, what you're going to do now without the plastic bag is you're just going to point your knee forward and keeping your feet planted onto the ground now. Using your knee, just go side to side. Open it outside and bring it back in. So go out and bring it back in. Okay, don't let your leg flop out this way. Really control it going outwards and then coming inwards. Okay, this is going to be a little bit more challenging compared to the plastic bag. Okay, plant your feet on the ground and do this movement. So you want to do for 10 repetitions on each side. Okay, so 10 that way and 10 this way, and do it for 3 sets. Okay, this is your hip rotations. Next, for your knee extension, previously we did it with the plastic bag, so now without the plastic bag, we're just going to try and extend your leg as straight as you can. Okay, as straight as you can doesn't mean that you have to go all the way straight. Even if you're just lifting off your heel off the ground, this is already a good start. So just hold it there for a few seconds and come back down. So as you're going up, and especially when you're coming down, don't let your leg flop down like this, okay? So straighten it out as much as you can, hold it for a few seconds, and come back down slowly. So this is for your knee extension. It's an upgrade of the plastic bag one. Straighten as much as you can, and come back. So as you're doing this exercise, you really want to feel the quads muscle here. You really want to look at it and really look at it and make sure that you're actually firing up the correct pattern, straightening it and coming back down slowly. This exercise, you're going a bit more higher up for the hip. We're going to do a bit of marching, okay? So I want you to sit out a little bit more in this position, okay? I'm going to show you on both legs. So this is the weaker leg, this is the stronger leg. Okay, so you're just going to lift up a little bit and down, and do it on your stronger leg. Up and down, up and down. Okay, so for your weaker leg, you are going to have difficulty to lift up all the way. So use your stronger hand to actually help lift up the leg. But do not make the mistake of using your stronger hand to only do all the work. Okay, as you're helping, your stronger hand is helping, your weaker leg also must do. Your hip must also start to fire up and do. Okay. So just help it go up this way and then do on your stronger leg. Okay, then use your stronger hand to help your leg go up and your stronger leg up. Stronger hand helping your weaker leg up for marching and stronger leg up. Okay, so for each, you want to do 10 repetitions on this leg and 10 repetitions on this leg. Okay, so one more time. If you can do it without the help of a stronger hand, then just lift it up as high as you can. You don't have to go up all the way. Just a little bit up is also good enough. If not, then use your stronger hand to help up and down, and then your stronger leg. Okay, the next exercise, you're going to go down to your ankle. Okay, so focus on your ankle now. This is your weaker leg. Okay, for category 2, what I want you to aim to do is actually to lift up your toes. Okay, so if you can see from this angle, look at my feet here on this leg. I just want you to lift up the toes as much as you can. Okay, just up and down. Okay, we are trying to get your ankle to bend upwards. Okay, so I'm doing it here and it looks quite nice because I do not have any neurological injury. So for yourself, when you're doing it, it may not be able to come up this much. Okay, so as much as you can do, just lift it up. Okay, even if the movement is not happening, as long as you're feeling some firing of the muscles happening in your leg, it is already a good start. Okay, so just continue doing it. 10 repetitions on 3 sets. Okay, another way you can do this is, because sometimes when you're flexing your knee in this position, it might be difficult, so you can actually extend it a little bit more, make it hang on the air like this, and then from this position, just try to bend your ankle up and down. Okay, just bend it up and down. You don't have to do a perfect movement. Okay, as long as you see some movement of the ankle coming up, that is already a very good start. Okay, continue doing it and your movement will start to come back eventually. So 10 repetitions and 3 sets for this leg. Okay, you can also choose to do it on your stronger leg, but focus on your weaker leg first. Okay, so this is slightly easier compared to keeping your knee flexed and lifting it up. Okay, this will be a bit more challenging for you. In fact, this will be challenging for you. So you can start off with this movement first. So in category 2, how to strengthen up your trunk is you're going to do 2 exercises. Okay, so imagine that this is my weaker side, this is my stronger side. Okay, what we're going to do is you're going to sit out forward a little bit more onto the chair. So in this position, using your stronger hand, I just want you to reach forward. So bend your trunk forward like this and come back. Okay, you may not be able to go a lot forward in front. Okay, even if you're just going a little bit forward and coming back, that is already very good. So if you're not able to reach further in front, you can just put your hands on your lap here and just control your body going forward and coming back. Okay, really just go forward, control it, don't let it flop down like this. Okay, and then come back. Usually, the going forward will be easier because you will tend to do it a bit more passively, but the coming back where you're activating your core and also your back muscles, that will be a bit more challenging. Try your best not to use your stronger hand to push yourself back, okay? Really use your core and your back muscles to actually extend your back backwards like this. So go like this. If you can reach using a stronger hand, just imagine you're grabbing something at the front, forward, and then bring it back. Okay? So you're going forward and backward for your trunk movements. We're going to do it 10 repetitions, 3 sets. Okay, the next one is actually you're going to reach sideways. So this stronger hand, we're going to go sideways and come back. Okay, so we're going to go sideways like this and come back. For this exercise, your base of support is within the chair here. If you are quite weak at the start, you may not be able to reach out of the base of support. So really be careful when you're doing this and always do this with a caregiver beside you, okay, or a family member. Just go to within the limits of your base of support and come back. Okay, towards the stronger side is still okay, but if you're going to go towards your weaker side, make sure you have a support structure like a table or a wall a bit further away so that if you end up falling, you actually have support against something that you can hold on to or push against. Okay, so for your weaker side, be very careful. Just lean slightly and come back. Okay, lean slightly and come back. Be careful, your base of support, your safety is actually within this area that you're seated. If you go beyond this, there's a high chance that you may just tip over. Okay, so stronger side, you can push a little bit more, but weaker side, be extra careful and do this with someone watching you or supervising you. Don't do this alone because you may end up falling and injuring yourself. So next, in category 3, you are able to stand, but you're not able to walk yet. So what will usually happen in this stage is when you're standing and you're trying to walk, what will happen is when you're putting weight on your weaker leg, your leg is just buckling and collapsing down, which will actually reduce your confidence in getting yourself to walk. So the aim for this stage is firstly to improve your balance in standing. Second is to get you to weight bear more on your weaker leg such that when you are lifting up your stronger leg, your weaker leg is not buckling down or falling down to the ground. And lastly, to also increase your confidence in being able to stand and walk. So these are the exercises that I'm going to show you here. This will be very useful to be done at home. Okay, so now for your category 3 exercises, okay, what I'm going to show you is a bias sit to stand. Okay, so what I mean by a bias sit to stand is usually when you are having a stroke or a neurological injury, when you want to stand up, what will usually happen is that your body will just compensate in a way such that your weaker leg tends to go out and your stronger leg tends to come back in. This is a position and this is a compensation that your body tries to automatically do so that you can actually stand up easier without exerting much force on your weaker leg. Okay, so this is my weaker leg for the demonstration now. Okay, so what I want you to do is reverse this. Okay, so you want to reverse this compensation by bringing your weaker leg back in a little bit more, stronger leg slightly forward. Okay, not really forward like this, but just slightly forward, just half a step forward. Okay, for a start, you can use your stronger hand to push off in the table or support structure when you're doing this, but eventually I want you to do it without pushing off. Okay, this will be challenging at the start. So weaker leg, push back, Okay, this is going to bias the weaker leg even more. So it's going to force it to actually put more weight when you're standing up, and stronger leg is going to be slightly forward. And this position, just stand up and sit down slowly. Okay, you're going to feel unsteady if you're doing this for the first few times because you are actually challenging your weaker leg a lot. So do hold on for support, and even if needed, get your caregiver to help you out in this. Okay, just up. Okay, the key is to sit down slowly. Okay, sit down slowly and do not fall back down like this. Don't do that. Slowly sit down. Need help? Just hold on to this more. Okay, stand up and down slowly. Good. Okay, so we are biasing the weaker leg by forcing it to do more by putting it slightly backwards. Okay, do this for 10 repetitions and you do it for 3 sets. Eventually, if you're able to let go of this, then just put your hand on your lap and stand up and sit down like this. Okay, really make sure you control slowly up and slowly down. Okay, so moving on to the next exercise, we're going to do a half squat position with a weight shift to your weaker leg. Okay, so for this exercise, ideally you want to have something to hold on at the front, either a chair or a table at the front. But since I will block the angle, I'm just going to show you holding on to the side here. Okay, so for this exercise, this is going to be my weaker leg and this is my stronger leg. So what is going to happen is, when we are doing a sit to stand movement, we are not going to fully extend and stand up. Okay, so we are going to stop here halfway. Okay, in this position, your butt off is here. Your butt is not straightened all the way. You're not standing up. You are in a half squat position. And in this position, what is going to happen is you're going to put more weight on the weaker leg. Okay, so you're going to come to the weaker leg and go back and sit down. So get into a half squat position. Okay, move to your weaker side and come back and sit down. Half squat. Okay, moving to your weaker leg. This is going to help you to build up the confidence, because when you're going to walk eventually, you're going to be able to put on all the weight on the weaker leg and then take a step on your stronger leg. So this is what we are preparing you for. Get the confidence so that you'll be able to walk eventually. So 10 repetitions, go up slowly, shift the weight to your weaker leg and sit down. If need be, get a caregiver or a family member to stand on the weaker side, because as you're shifting to your weaker side, you may end up falling. So you can either do it against a wall on this side, or best case scenario, just get someone to stand by here so they can catch you. So for this exercise, do not do it alone. Okay? So one more time. This is my weaker leg. We're going to stand up, half squat position, lean to the weaker side for a while and come back and sit down. So you're moving to standing exercises for category 3. First, I want you to try doing this standing weight shifting, okay? So this side is my stronger side and this is my weaker side. This is my weaker side. So on the stronger side, hold on to a chair for support, okay, on the stronger side here. Okay, what we are going to do is we're going to stand shoulder width apart, and while holding on to the support, we're just going to push to the weaker side and come back, okay? Push to the weaker side and come back. So be careful as you're pushing here. You really want to hold on to support, because in this side of the space, there's nothing here. So you want to get a caregiver or family member standing on this side when you're doing this exercise, because you may just give way and fall onto this side. So be very careful when you're doing this. Get supervision and get someone to stand on this side of the area. So come towards here and come back to center. So what you're doing is just trying to gain some confidence and putting the weight through the leg and trying to not let the leg buckle down. That means as the weight comes here, try to really focus on your hip and your knee and focus on contracting that, such that when you come here, you don't fall down like this, okay? So do about 10 times, come to the side here, okay, and come back to neutral. So go here and come back to neutral. Okay, so this is standing weight shifting to the weaker side, okay? Okay, next is actually one of my favorite exercises to actually train up the weak leg to make it be able to stand and hold the weight on the leg. Okay, so for this, you're going to end up holding onto something on the stronger side. Okay, so this is my stronger side and this is my weaker side. So what we're going to do is first we're going to stand shoulder width apart like this. Okay, so while holding onto this, I want you to get into a semi-squat position. That means just keep your knee bent a little bit. No need to go all the way down. Okay, just keep your knee bent. Don't keep it straight like this. Keep it bent. Okay, from this position, while you're holding onto this is my weaker leg again. Using your stronger leg, you're just going to step forward and back. Okay, so you're keeping your knee in a slight flexion. So if you can see here, you're going to bend it like this. Okay, keeping that in that bend position and just going to step forward on your stronger leg and back. So this is actually simulating how you're going to walk eventually. So you're just going to put down the weight on the weaker leg while your stronger leg is taking a step. Okay, this is going to be challenging, but this is a very good exercise. Okay, so at the start, you don't need to take a big step. If you take a big step, it's going to be much more challenging. So just small taps. Okay, no need to even take a step. You can just tap and come back. Tap and come back. Do for 10 repetitions. This will be challenging for you. If you don't feel safe doing this, get someone to stand on your weaker side. Okay, forward and back. Do it slowly, okay? Don't do it fast. And rest. Okay, so I'm going to show you again a little bit of a different angle. What's going to happen is you're going to keep your knee bent slightly, and using a stronger leg. Okay, stronger leg is this side. Okay, you're going to step forward and back, forward and back, forward and back. If you are difficult to do this by taking a big step, just little bit forward taps and back, forward taps and back, forward taps and back. I have listed a few products below in the description and do check them out if you are keen. These products will be useful if you belong to category 3 and 4. The first product that I'm recommending is actually ankle weights, and ankle weights are a very good addition to make your legs a bit more stronger, especially for the exercises that I show in category 3 and 4. So you can just put them on and continue exercises shown in this video in category 3 and 4. And also on top of ankle weights, you can actually also buy TheraBands, and they come in different colors. You can start off with either a yellow or a red color if you are in the beginner stage, but if you want a little bit more of a resistance, you can go for the green color and eventually maybe blue or even black, but start off with a yellow or red first. And you can also attach this to various support structures within your home to do some of these exercises shown in the category 3 and 4. So as you're doing these exercises in category 3, do keep in mind that your walking ability will start to return pretty soon, and you may need some walking aids for you to be able to walk independently or with assistance. So start talking to your therapist or your doctor on finding a suitable walking aid for you, and then continue to train it during your therapy sessions or when you're actually walking with your family member or your loved one. At this stage, I highly recommend you to not walk alone because you're still at a high risk of falls, and this will actually lead you to having a lot more injuries if you're not safe in this stage. So be careful at this stage, walk with someone always. So coming to category 4, this is the stage where you're already walking, but you want to improve your walking distance and your standing and walking balance a little bit more. So in this stage, what you'll be able to do is you'll be able to at least walk around your house, but moving around the community might be a challenge for you. So what this means is that our aim in this stage, you need to improve your standing balance and your walking balance. Next is you need to improve your walking distance, mainly your endurance. And lastly, to actually get you to be confident in actually doing a lot of this obstacle negotiation, because once you're in the community, you'll have to walk on uneven terrain and also a lot of curb crossing and steps that you have to overcome to be safe. So the first exercise is actually just to walk longer. But by walking longer, what I want you to take note is this. For example, if you are able to only walk for 5 minutes and you get very tired and you need to rest, how you want to progress this is by dividing it into 2. So instead of walking for 5 minutes every time, walk for 2.5 minutes. After a 2.5 minutes walk, just rest for a few minutes and continue doing this for 4 repetitions. That means 4 sets, meaning you're going to be walking a total duration of 10 minutes. So this is actually indirectly improving your ability to walk further, not by increasing the number of the minutes that you're walking one shot, but rather increasing the total volume that you're walking. So instead of doing a 5 minute only, now you're doing a 2.5 minute times 4 times. So this is actually increasing the overall distance that you're walking, but you're taking breaks along the way and then doing the walking. So on top of that, these are the home exercises that you can do for this category. Okay, so moving on to category 4, we are going to focus on standing balance exercises. Okay, so for these exercises, I want you to hold on to something, because balance exercises will actually challenge your balance and you may actually end up falling. So always have some support for yourself. So the first standing balance exercise is, I just want you to bring your stronger leg forward. Okay, just bring your stronger leg forward and your weaker leg at the back. Just hold this position. Okay, hold this position for 10 to 30 seconds. And in this 10 to 30 seconds, your stronger hand that is holding onto your support, you can actually let go of it slightly. Or you can even just put 2 fingers here and really try to balance using your leg to maintain your balance and not be wobbling sideways like this. Okay, so this is a base level. Okay, and then come back after 10 to 30 seconds. Okay, you can do this for about 5 to 10 repetitions, but it'll be tiring for you to do 10 repetitions. So you can just do a start of a 5 first. So this is what you can do at the start. Okay, just a step forward, hold it for 10 to 30 seconds with some support here, and then coming back. If you want to take it up a little bit more further, close your feet together and then step it further in front. Okay, so this is really narrowing the space that is present for balance in your leg. So stronger leg forward, weaker leg at the back. Okay, maintain this position for about 10 to 30 seconds. If you really want to challenge yourself, then let go of the hand. But I suggest for a start, just hold on to the support first and then come back. If you really want to challenge further and you're able to do it, what I want you to do is actually focus on single leg standing. This is your weaker leg. Okay, so you're lifting up your stronger leg. Your weaker leg, you're just going to stand on it. Okay, so this is a very high level version, and for this at the start, better to do it with someone standing beside you so that they can catch you if you end up falling. Okay, then bring down. Up, hold it for about 10 to 30 seconds, and down. Similarly, if you want to challenge yourself, you can actually just put 2 fingers instead of your whole hand holding here. 2 fingers here and up. Stronger leg is lifting up, weaker leg is standing and balancing. And down. And up. Hold for 10 to 30 seconds and down. Okay, I'm not showing you the entire 30 seconds, but you can try it by yourself. Eventually, if you really become much more confident and your balance is improving, then you can actually just do a single leg stance without even holding on to anything. But this is a high level activity. At the start, always do it with someone standing beside you, because this is an activity that can make you fall. Okay? So for a start, always hold the whole hand, 10 to 30 seconds. Your weaker leg is the one that's standing, and put down your stronger leg. So we've come to the end of the video. Thank you, and I'll see you in the next video.